why is this the best business opportunity in America? Well, we're going to show you. I've got I should have Jason Pettit on the line here. Jason, you with us today?
I sure am. Am I coming through loud and clear?
Yeah, loud and clear. Sounds pretty good. So thanks for joining us. And you and I are just going to kind of banter back and forth here as we go. And like I said, everyone who's on this webinar, if you know, any questions come up, type them in there, and we'll certainly try to get to all the questions as we go here. So I'm just going to kind of talk a little bit, go right into the industry. You know, I don't know if any of you have seen this particular graphic. Well, I think we showed it on a webinar a few weeks back, but this was a very important article that came out in Inc. magazine. You can see the date down there, September 2015, so very recent, talking about the places that you should be as far as the industry growth. And if you guys can't find the healthcare there, look for the giant mountain in all of these little bumps here. Look for the giant mountain in the back. That's the healthcare mountain. I mean, it is such a big industry with projected money being spent in that industry, projected out to what is it, 13.2 billion in 2014, and it's growing more and more and more each year. So it's just on an upward trend, and it's kind of skyrocketing because of all the different things that have gone on in the industry in the past couple of years. So there's a lot of money being spent in healthcare, and it's basically one of the top as far as the money being thrown around. I mean, for each one of you people on this webinar, there is plenty of room for each one of you to get involved in this industry and get a piece of that pie, and no one would even run into each other. I mean, there's so much opportunity with the different services and products that we can offer, and the fact that you can offer them to virtually any specialty you can think of. The other thing is we're not a franchise, so you're not limited to a certain territory either. So you can actually market to any medical provider in the United States. I mean, this is an amazing opportunity for people to make some real good money with not having to have a whole lot of clients. I mean, you can make close to 6 figures with just a handful of clients. You could certainly go and do something like this on your own, and people have done that. Some people have been successful because they they knew exactly what kind of marketing plan they wanted to do, but most of the time what we see is people kind of struggle with the marketing side. I mean, anybody can go out and get, and this is a book right here, this Entrepreneur Magazine startup book. You can go get this on Amazon. And it's how to start your own medical claims billing service. And so it gives you a step-by-step guide. But even that, that book's going to give you a lot of really good technical information and know-how. But when it comes down to actually, how do I get a doctor to actually give me 5 minutes of his or her time? How do I get my foot in the door? How do I even find doctors who are going to be even remotely interested in what I'm doing? That's where American Business Systems comes in. And as a matter of fact, Entrepreneur Magazine has actually listed us as the only business opportunity that's worth checking into if someone feels like they need a team of people behind them, helping them and guiding them every step of the way, because that's what we do. So hopefully that makes sense. But yeah, go check that book out. It's on Amazon, I believe. But I guess a big question on several people's minds is, isn't this all just about medical billing? I mean, what is all this other stuff you're talking about? I mean, and there may be people on this webinar that don't even understand what medical billing is. So, I mean, Jason, do you want to touch on that?
Yeah, I'd love to, Adam. And if you don't mind, could I throw you a crazy curveball before we go to this slide? Can we go back? Can we go back to the mountain slide and look at the
I love that slide. Let's do it. Yeah.
I want to point out one thing, just in case everybody missed it, because it's very small on the screen. But the little green percentage that's underneath the 2.1 billion in the healthcare market size, that's the percent increase from 2013 to 2014. So I thought I'd highlight that because, we're not talking about an industry that's treading water or, going the opposite direction, which is a concern in many, many industries right now with today's economy. Healthcare is growing so fast. I wish we could keep up with it. We've had our best 5 years in our 22-year history at American Business Systems, but our licensees are signing up new clients, new doctors' offices right and left right now. So that's an important stat. you're not getting into an industry with American Business Systems and with healthcare that is in any danger of going anywhere anytime soon. 60% growth is just unbelievable. I mean, you can look at the other industries there and see that healthcare is definitely the place to be. And we can go back to the other slide now, Adam. I thought I'd just rewind and point that out because it's such a tiny little number on the screen, but it's actually a huge number.
Yeah, I mean there are other industries showing good growth, but we're like one of the few with a B at the end instead of an M at the end.
Correct. I think B stands for better. I could be wrong. So yeah, so what is medical billing? What is this industry that you're planning to get into? Why do doctors need services like this? Do you need certification to do medical billing? What is this crazy thing called medical billing? Well, medical billing in a nutshell is filing insurance claims on behalf of the doctor so that the doctor gets reimbursed for procedures that they perform with their patients. That's about the cleanest way to describe it. And the way they get reimbursed is by putting the right procedure codes and diagnosis codes on the CMS 1500 form that Adam has pulled up here.
This looks really complicated and scary, though, this form.
It does look complicated and scary. We're not going to spend a lot of time talking about the mechanics of billing today, but what I would recommend for those of you on this call today, reach out to your American Business Systems business coach, whoever you're currently working with, and if you haven't already, get a live software demo and let them show you live how to file a claim. And I'll tell you, that's one of the most eye-opening things, at least it was for me the first time I saw. It's not that there's not little quirks to it and things that you have to learn, and some specialty medicine requires some different attention when you're doing filing the claims. But you would be amazed at how quickly you can fill out a claim form once you learn how to do it. So definitely recommend you reach out to your American Business Systems rep and get them to offer you a software demo. If you haven't already had that, that's a great one.
Yeah, and I think one more thing to underscore on this page is most of the time the clients that our licensees get, the doctors that they sign up, the doctors are the ones giving them the codes that you see over here on the right. The doctors are actually saying, okay, let's use this code and let's use this code to send to the insurance company. So licensees, their role is really more just data entry. You're not having to decipher different coding, procedures and stuff like that. So it's quite a bit less scary than one might think. But beyond that, medical billing, like I mentioned, is just one part of the total what we call revenue cycle. So do you want to talk about how we actually certify people?
Yeah, absolutely. We get the question all the time. Do I need to have certification for billing and coding? Do I need to go take classes at a college and things like that? And no, you don't. It's certainly not a prerequisite, although some of our licensees do end up, as they build their businesses, taking classes and things like that, or billing boot camps to learn more about the billing and coding process. It is absolutely not necessary. Imagine this. You're running an automotive service center, and you're the owner, and someone's going to come into you and say, I need you to diagnose my car here with exactly what the problem is. Now you have a team of technicians to do that. You're not necessarily going to be the expert on every single part of the car. And so that's the best analogy I can come up with for what a revenue cycle manager is. And that's the certification that you get with American Business Systems. So you're not going to have a billing specialty certification. You're not going to have a coding certification. You're going to be the revenue cycle manager and help the doctor with every aspect of their revenue cycle. That's from collections to reimbursements or claims filing, electronic health records. We can help the doctor with payment processing for their patients. We have some excellent coding services that we'll talk about later on, and we can even help the doctor with marketing so we can drive more patient traffic to their office, which in turn turns into more appointments, which turns into more revenue. And so if you think of it from the standpoint of you're running the service center and the doctor's in the car and you don't know what problems the car might have, but you have a whole suite of solutions, a whole toolbox, if you will, to help them out. So that's what a revenue cycle manager is, and that's a certification that you get with American Business Systems.
Yeah, and we actually do a live training that you complete. It's a 5-day class that we'll talk about. And you get a certificate of completion that says that you are a CMRM. And licensees do occasionally will add those letters after their name on their marketing materials, their business card, because you should promote yourself that you are certified at that point. And so that's just one of many, many different ways that we help you build your credibility in this business. There's another little view of a revenue cycle here that we can take a look at to kind of help illustrate what exactly that means, RCM, Revenue Cycle Management. So a lot of it, so basically it starts with the claims preparation, which involves registering the patients and checking their eligibility, which is something that our system does. And you guys are not going to be dealing with the patients. This part is actually done by the front office staff still. So the front office staff would actually use our iClaim system. You give them a login to use it so they can register patients, do the eligibility checking on their insurance to make sure they're going to get paid, and also use the scheduling program and some other things. Then it goes to the claims submission portion, which is where you're actually, the licensees are actually taking the claim information, putting it into the system and submitting it to the insurance companies. And then the claims management portion is what comes back from the insurance companies, because the insurance companies will send information back into our iClaim system, and they'll give you the information on who was, what the patient paid, what the patient owes, I should say, what the insurance company covered, and that can all get recorded into each patient's record. That's the next step. And then the final part of it all is the reporting and the analysis and making sure that everything has been being done properly. And you can actually give the doctors login access so that they can go in 24/7 and they can see the reporting and see exactly where their money is at any given moment. And that has a very positive impact on the doctors feeling comfortable with outsourcing to you, is knowing they can access the system from their phone on the golf course or whatever the case may be, and know that someone else is taking care of the hard part, and they're just looking at the reporting and seeing that their money is coming in. Here is a quote from the blackbookrankings.com. It came out recently. They did a survey, and 42% of all the physician practices that had 1 to 5 doctors with employed billing staff, they hope to outsource their billing in the next 12 months. That's a huge stat, 42%. So that just speaks to the need for our services, the need for what we're doing. A lot of licensees, or a lot of people that are looking into this opportunity, they say, aren't doctors doing this already themselves? And yeah, a lot of them are, but they're having a hard time trying to manage it all. It's usually costing them a lot more money, paying billing staff internally and software and hardware and all this other stuff. So that was a pretty good quote. Do you want to talk about this one a little bit?
I do, and I'd just like to point out also on that slide, if 42% of 1 to 5 doctor practices are in the market for replacing their current billing solution, if you think about that slide we had a little while ago with the market size, think about the massive potential that's out there right now. If close to half of that multi-billion-dollar market is up for grabs, that doctors right now are searching for better solutions for their revenue cycle management. So it's a pretty incredible quote if you look at it. I mean, 40% is an absolutely enormous market to go after. And one of the reasons that doctors are seeking out replacements for their current solutions is this quote right here from the New England Journal of Medicine. Market analysts estimate that 24 cents, 24 cents out of every dollar are wasted on administrative and billing expenses. So it's in the neighborhood of a 25% cost factor for the doctors to manage this themselves. The flip side of that with American Business Systems licensees is we can help them actually increase their revenue. We're not adding additional expenses. We're increasing their total revenue bandwidth. So they're actually generating positive cash flow even after they pay the fees that our licensees charge. So again, another just tremendous upside in the industry. And we've got one more industry quote here from U.S. News. Now, this is Dr. Vern, and I'll let Adam pronounce the last name there. Go for it, Adam.
No, can't do it.
No, can't do it. Yep.
Nope.
Haven't had enough coffee yet today, and I've had
Nope.
about 3 cups. So in order to get paid by the insurance company, the estimate here is this doctor, it says he has to pay about $20 in administrative fees to collect it. So between the bills, the computer system, the ongoing support, it costs about $20 per claim. What an unbelievable cost factor built into what we know the nationwide average for the claim amount for the doctors are collecting is $100 to $125. So that's close to, again, like we saw in the previous slides, a 20 to 25% cost factor with current billing solutions. Now, again, when we can implement our services and increase the doctor's revenue, sometimes 20 to 30% increase, the doctors are making a net revenue improvement, not adding on additional cost. Very important aspect of what we do there.
Yeah, and here's another point I want to make on this slide. This doctor is very rare. He actually took the time to crunch the numbers and see what it really costs to do, to process the claims. 9 times out of 10, doctors have no idea that it's really costing them this much to collect their money. And that's what we do. We help educate them through doing a practice analysis and some other things that we'll show you. And so so part of the process of getting doctors as clients, signed up for your business is educating them on, look how much this is truly costing you when you take into account all these different factors. So this guy, he's pretty rare. Most doctors are not good business people and they have no clue, and that's what we do. We help them realize that they could, most of the time it makes more sense to outsource. Yeah.
Good point. Not many doctors are like Dr. Cherebitinko. I think I got it right there.
Hey, that sounds pretty good.
they go out and actually take the time to crunch the numbers and figure out what their cost factor is. We spent a little more time illustrating this with the graph that you see here. If I could, I'm going to hit the pause button and I'm going to ask our audience, for those of you who have been exploring the opportunity with us, in your control panel, there's a little button with a hand on it. I think that this is activated for everyone. Correct me if I'm wrong, Adam, but click that button if you have found our income calculator on our website. If you've seen that before and used it, I'd just be curious how many hands we get raised on that one. Okay, great. It looks like a couple people immediately lighting up there.
Andre, Bill, Dev, Alita, Valerie. Yeah, a lot of people have seen it. Good.
Yeah. Hey, Dev. Good to see you on the call today. So for those who have used our medical billing income calculator, you'll see that the number there on the right at the top of the outsourcing column, the $31,200, that's a good yearly estimate of what you might generate with one doctor's office. Now that's yearly income for you. So the way that is calculated on that top line, 20 claims per day at an average of $100 per claim, using a 6% fee that our licensees charge to the doctor. So that's $31,200. That's your income as the service provider for the billing. And then you can see, I'm not going to go through every line item there, but you can see when you tally up all of the cost factors that the doctor has to do their own billing in-house, it's more than double the cost that they would have using our services at ABS. So this is another just illustration of how much more cost effective it is for doctors' offices to use your outsource billing solutions versus trying to handle it themselves. And that's why doctors are seeking out alternative methods, is because they can see that they're paying so much money to have these services done in-house.
Yeah, this is a very simplified example of what our practice analysis looks like. We give you the questions to ask. We give you a series of, it's like 20-something questions, 20, 30 questions that you ask the office manager or the doctor about these particular fees and some other stuff outside of what you're seeing here. But imagine if you were to just hand this to a doctor and say, look, based on the information that was given to us, in doing an analysis of your practice, look, here's what we can do. You're spending about $65 grand a year right now and we could do your billing for 31. I mean, why wouldn't you do that? You know, but it goes into much deeper detail, the practice analysis that we have. Yeah, we can show that calculator real quick if you want to do that, Jason.
Sure. Yeah. For those of you who haven't been to our main website, absystems.com, the income potential menu right there in the middle of the screen, and when you click on that, it'll take you to the medical billing income calculator, and it's kind of fun to play around with. You know, if you're coming from a different industry and if you're working a current, regular job, and you need to replace a certain income in order to be able to transition full-time to being an American Business Systems licensee and running your company with us, if that income figure, if you'd like to see how many doctors it would take as clients to get to that income figure, or you'd like to just kind of play around with the numbers, this is a great way to do it. And it's a conservative estimating tool. We're not guaranteeing anything about the income figures, but it'll give you at least kind of a bird's eye view of what's possible with a business like this. And I know you'll enjoy playing around with it. So you find that on our main website, absystems.com, under the Income Potential tab.
Yeah, and then as you can see, just based on those numbers that were plugged in right when you go to that calculator, which, by the way, we got those figures from actual licensees. So if you just go to that calculator and don't even touch anything and just hit the submit button, you'll get this figure here, $31,200 for one office, which equals an average monthly gross income of $2,600. That's one client, one doctor. Your next question should be, well, how many doctors can I sign up? How many doctors can they sign up?
Well, it depends. It depends on how many doctors you want to sign up. I want to point out something else here. So $2,600 a month. Certainly I would guess that most people on this call are anticipating that they're going to generate more than $2,600 a month from a business like this. So we need to clarify, this is one single doctor's office, solo practice, not a group practice or anything like that. And if you do the quick math on this, at $2,600 a month, in 10 months of billing, you should generate in the range of $26,000. So in 10 months from you getting your first client, you will break even on your investment with American Business Systems. Now, many of you may have looked into other business opportunities, and we've explored many other opportunities in the sub $50,000 investment range, but I challenge you to find one where with one single client, you can break even on your investment in 10 months. I'm not aware of anything else that's out there like that. So that's a pretty compelling offering. And then, of course, your full year of income would be $31,200. And I like to say, conservatively speaking, your first client, you should expect, if they're a general practitioner or family doctor, you should expect $25,000 to $35,000 a year in income from that particular client.
Yeah, but remember, you can sign up virtually any specialty. So when you start getting into the specialties, those specialists are filing pretty high dollar amount claims, and you're still making a percentage on those claims as well. So those can be very lucrative, more so than the family practitioners. Yeah.
Adam, I'll point out, we're starting to get some questions here in the question panel, and it's great. We've got some good ones, one from Dev, one from Marilyn, and we are going to take questions here in just a few minutes. So for the rest of you, if questions are popping up in your head as we're going through this, feel free to just type them in that control panel window where it says questions, and we will address those here in just a few minutes.
Great. Well, let's go ahead and go through some of the services. Some people might be wondering, well, what else is there? We can briefly kind of touch on that. I mean, we're already at 3:30 right now, so we're going to have to kind of just float through these, but we can certainly give you more detail offline, but we'll just kind of give you a quick overview of how some of these services, what they are and how they work.
I'll try not to interrupt you anymore, even though I do.
No, it's okay. So other streams of income. So I showed this picture before. This is just to kind of illustrate that we have many different products that can help in different areas. Some licensees, they have clients that they're maybe not doing the billing for right away. They're offering other services like the collection service that we'll talk about, or a Medicare audit protection service, or who knows what. But then when the doctors see the efficiency of those systems, a lot of times they will, down the road at some point say, hey, why don't you go ahead and take over my billing too, because my biller just quit or something, So you never know how stuff may come about. But firstly, let's just talk a little bit about iClaim and EMRX. So, whoa, I don't know what's going on there. That's a weird graphic. So it's like I mentioned, it's a cloud-based billing system that is fully integrated with our electronic medical record system that we call EMRX. And those are two different products that can be sold together, integrated, or they can be sold separately. What sets us apart is the fact that every bit of this system is completely cloud-based, from patient to doctor to the licensee to the clearinghouse. There's virtually no paper. It's virtually paperless now. So the patients have a portal that they can access that allows them to see their medical history. It allows them to request an appointment or reorder prescriptions, do all kinds of stuff in there. The doctors themselves can use the EMRX for when they actually see the patients. And a lot of times licensees are offering iPads with part of the deal. If the doctor signs up with a licensee, they'll throw in some iPads as part of the deal. And the EMRX system actually was designed for use on a tablet specifically. It does run on a laptop or a PC or whatever, but it looks really good on a tablet device, and all the buttons are very easy to see and read and press with a finger. It's designed for touch. It's also designed for dictation. If they would rather dictate, they can talk into the system as well, because iPads will do that. And I think other tablets have that Dragon dictation as well. Or they can just type, if they would rather type. So it's the 3 T's, touch, talk, and type, which allows doctors to kind of work the way that they want to work, and they don't have to really relearn anything. And then the iClaim screen itself here that you see in the middle, that's where licensees go and handle the claims that are coming in from this part, where the doctors are putting in when they see the patients. So the doctors see the patients, they do what's called the encounter with the patient, where they check out their vitals and everything, and then they actually, at the end of the encounter, they select the codes they want to submit to the insurance company, and then that gets sent over here to this iClaim system immediately in real time. So you'll be in this claim status section here, the licensees will, managing those claims that are coming in. So it's very easy. And like I said, we can give you a demo of it. Just give us a call and we can demo how it works and kind of show you a day in the life of a licensee and what that looks like. But yeah, it's connected to all the public and private insurance companies out there, you name it. So really, you just type in the codes that they give you, click submit, and it goes to the insurance company. And then the doctor gets paid in about 7 to 21 days. That's the other thing with our system, is doctors are getting paid very, very quickly with this system because the claims are so clean. Yeah. So
Adam,
let's see what else. Yeah.
A lot of people don't understand this, but all insurance companies have their offices in tiny versions of the Empire State Building. I don't know if you knew that.
I did not know that. No.
don't build that slide out again. It's too late. The joke's over.
Oh no. I went back.
It'll take about 10 minutes to build this slide out again. Actually, I'm being funny here, but it's a very important thing to understand the advantages that our platform has over what's standard and common in private practice today. So the average rejection rate of other software platforms and billing methods is 34%. Now I'll say that again. The average rejection rate nationwide is 34% of claims. Imagine if you only got, let's not include the discussion about taxes, but imagine if you only got 70% of your paycheck every week or every month. You wouldn't stand for it. Well, doctors struggle commonly with 20 to 30, we've seen as high as 50% rejection rates. Half of the claims that the doctor submitted were rejected. It's unbelievable, and it's really, kind of speaks to the tragedy of our healthcare system, where doctors are working and not being paid. Well, not with our system. Using iClaim, our billing and practice management system, our rejection rate is less than 2%. So it is very common that when we go into doctors' offices, and just simply changing the software gives the doctor a 20 to 30% bump in revenue because of all those rejections that used to be kicked back. that are now getting paid the first time they're submitted. And that is a huge claim to make. Nationwide, month over month, our rejection rate is less than 2% with iClaim. And you're able to say that when you're out there marketing. So it's a killer stat for us, for sure.
Yeah, and if you're sitting there thinking, well, how the heck is that possible? It's because our system is so efficient, and the fact that it's web-based. Anytime there's changes to regulations or medical codes, or now the government says, well, now you have to do it this way instead of this way. There's all these new initiatives that the government rolls out that doctors have to try to follow, and guidelines they have to try to follow. We take care of all of that for you behind the scenes. So it's any kind of initiative that you can think of. It's already been certified and already been secured for those particular certifications. Like it's, I can throw out a bunch of different buzzwords that you guys may or may not know, but meaningful use. It's certified for meaningful use. It's certified for ICD-10. I mean, you name it, it's already been done. Like whenever the government makes an announcement and says, okay, now by this date, every doctor needs to be doing it this way. Well, we've already changed our system and updated it and made it ready before that rollout date even occurs. That's exactly what we did with ICD-10, the new set of medical codes that came out this October. We were actually certified for ICD-10 over a year ago, and we were ready for it when it was supposed to happen last year, and then it didn't happen. But now it did happen, and we were ready for it, way back when. So it just makes you guys, the licensees, you don't have to worry so much about the system and the technical side of things, because we take care of a lot of that. Like I mentioned, it's designed for iPad. It runs beautifully on an iPad. It looks great. It has drawing tools built in where the doctors can actually draw. They can take a picture of the patient's foot or arm or eye or whatever they're working on, and they can actually make notes and annotations on the system. One big feature that we just updated was what we call telemedicine. And that is that's going to actually, if you guys start researching that, Googling that, you'll see that more and more telemedicine is coming into play for people that are in rural areas that are not able to make it to the doctor, or even large metropolitan areas where the doctors are just too busy to see people face to face. They can now do an actual webcam visit over the internet, and a lot of insurance companies are actually starting to pay for that visit and those procedures that way. It's got a real-time reporting system built into it, like I mentioned earlier, where it's got all kinds of charts and graphs that are updated in real time as the claims are being paid and submitted to the insurance companies and all this stuff. One neat thing I didn't mention about our system is that, yes, the doctors can log in anytime they want and see the reporting, but even beyond that, you can schedule an automated report to go into the doctor's inbox every week or every month or however you want to set it up, so they don't even have to log into the system. They can just get that report from you automatically, and makes it seem like you're on top of your game without you even having to think about it, because you set it up to do it automatically. So yeah, we're really excited about our system that we have, and like I said, like Jason said, if you guys want a demo, just let us know. We can do that.
Yeah, I would strongly encourage anyone on this call who hasn't had a demo yet to get one. It's really where everything comes together. So we're going to talk about AutoCard now.
This is actually the animations are messed up on those. The animations are messed up on those flyers. So this is actually a quote about.
It only stayed on the screen for a second there. I think that what they meant was Quick Collect.
Quick Collect, yeah.
This service is. So Quick Collect is designed to help the doctor with patient collections. I'm going to do a very, very quick scenario here to illustrate what we're talking about. When you go to the doctor and you're finished with your exam and you go to the little window to pay, and the person at the window says, I'm sorry, Jason, but you've got a $500 balance that's due today because your insurance only partially covered your procedure. And what do we always say? Oh, I can't do that today. Could you bill me later? Well, as this statistic on the screen says, physicians typically collect on only about 50% of outstanding patient balances. So the moment the doctor offers that bill me later feature and the patient walks out the door, they've got a 50-50 shot of seeing a dime on that procedure. So doctors lose a lot of revenue with that policy. Yeah, sure, we'll bill you later. And so Quick Collect will help the doctor and helps our licensees in marketing too, go after those collections and pull that revenue back in. And it's a very sophisticated collections engine. Without going into a ton of detail, you can ask your American Business Systems business coach for more detail on this. But basically what it does is it allows the doctor to send out collections letters, and it even escalates to phone collections and litigation if that's what it needs to ultimately go to if the doctor chooses. And it's all without your interaction. So you're not running a collections agency or anything like that. You're just uploading the database of those who owe the doctor money, and the system goes after it for you. And it's got excellent collection rates on it. So this is a great one, and it works hand in hand with our other kind of sister program, ChoicePay, which allows a doctor to set patients up with legitimate need on a bank draft to have a monthly collection come back at an affordable payment option.
Yeah, good stuff. Let's talk about coding. We have an actual coding service. I mentioned that to people on this call that you don't have to know much about coding at all because of the fact that we have all of the codes built into the database and maintained by us. But what if there is that stupid slide. Every one of those is going to be wrong.
Animations are great. They look excellent.
Okay, so there was a quote there from Mike Inger at a company called Avia Code. He says the average physician could increase their monthly billing by about 30% if their medical coding was done accurately. So there may be cases where a doctor says, you know what, I do need help with my coding. I want to make sure that I'm not over-coding, which means getting paid for things that he didn't do, or under-coding, which means they're not getting the money that they deserve, based on what they've done for the patient. So in that case, we actually have a bank of certified coders ready to go and ready to do work for you. So we have people that have already gone through the certifications of ICD-9, ICD-10, everything that is required, and they can actually help your clients code their claims properly and get them filed, help you get them filed to the insurance companies, and to make sure that they're, getting paid what they should. This that you're looking at here on the screen actually is kind of related to that. It's called Audit Guard. There could be, there actually has been, a lot of cases where Medicare has decided to go in and do an audit of a practice. And they take a look at a bunch of different claims and patient charts, and they make sure that everything was done properly from start to finish. And you know what? It's really, really difficult for doctors to make sure that that's done in a proper way if they don't have anyone guiding them and showing them, no way, you should probably do it this way instead of this way, so on and so forth. So that's what this is. This is a evaluation audit. We call it Audit Guard. And what this does is we actually have a technology partner that takes a look at 50 patient records and makes recommendations on if any changes need to happen with how things are being done, with how the visits are done, how the encounters with the patients are coded, so on and so forth. And we give you this full report that helps the doctors make changes to make sure that they're doing everything properly. If they're doing something wrong, whether they're doing it on purpose or not, they could get fined serious amounts of money from Medicare. So this service, Audit Guard, is a very good, get your foot in the door kind of thing. And those are just a couple of the services that we have. We have a couple of more. iDocs Now, it's an online document storage and archival system. It's it helps doctors get a lot of historical records and old patient files that they don't want sitting around in physical form anymore. They can put it up in the cloud. But I think, for this webinar, we'll go ahead and just start talking about the different marketing methods that we have. Now, you want to talk about that, Jason, and what we teach in the training class?
Yeah, all of these methods of increasing revenue for the doctor are great, but as a new American Business Systems licensee, how do we engage with doctors' offices? How do we identify, potential clients, and how do we broadcast our message and market to them so that we can grow our business? Well, we have many different ways that we help our licensees connect with potential clients in their area and go through the marketing process. And we teach those methods in our 5 days of live training. And so we're going to go through those quickly here, and I can see there's a lot of great questions in the question box, so we're just about to our question and answer portion. But here are the different methods that we teach you in our 5 days of live training. So web marketing. These are websites that we help you launch. We help you get these online, put your contact information on there so you have a web presence. And we also teach you how to leverage business networking groups. This is a very popular and successful marketing method that our licensees are using right now, attending BNI networking groups and meetup.com networking groups, connecting with other professionals who in turn can refer you, give you a warm referral to their clients who are physicians that need your kinds of services. This is one of our top 2 marketing methods right now. Also, automated follow-up systems. You know, when you're out there and you're connecting with doctors' offices, how do you stay in front of them and be top of mind so that when they do have a question or a need, they've got something from you right there in their office? Well, the secret is we actually use one of the services that's included in the business package, AutoCard. You can send out automated reminders to the doctor about your services and everything. We also provide educational marketing. You know, one of the most effective sales tools with any industry, especially in the healthcare industry, is providing education for the doctors. And one of those tools that we have is this book, Cash Crunch to Cash Flow, that our founder Patrick Phillips wrote a few years ago. And it's a great write-up on the different ways that doctors can learn to manage their cash flow. And of course, many of those methods include outsourcing their billing and some of the other services that you provide. And this is one of the marketing pieces that you'll have access to. We also teach you how to market in trade shows and expos, you know, medical, healthcare related trade shows and expos. This is, you know, we have 2 different booths. We have a tabletop booth and a full booth, and those are available for you guys to check out from the main office here if you have a local expo in your area that you'd like to set up and connect directly with doctors' offices. And Adam, I don't know if you clicked twice or if there was a slide in there that was added that's not in my notes. It looked like you passed one up there.
Yeah, no, I don't know what happened there, but.
Yeah, so the next one on my notes is the sales rep program, and this is probably one of our top methods right now. If you're like most of our licensees, the scariest thing about starting a business like this is, oh boy, I don't know if I can walk into a doctor's office, and what if I don't know what I'm talking about, and what if I can't find a client? I mean, those are all the fears and hesitations that everybody who has started a business with us in the last 22 years has had. And the sales rep program is a great way to overcome that and use the expertise and the network connections that a medical sales rep has in your area. So we have a formal sales rep program. We teach you how to connect with the local sales rep in your area and how to use their contact database to identify potential clients and get your first client as quickly as possible. So that's another amazing marketing method. And at the end of the day, what we teach you to do in our 5 days of live training is consultative marketing, meaning you're providing a consulting service. You are going to do an assessment, a needs assessment for the doctor's office. You're going to determine which ones of our services are going to be the best fit for the doctor. And that practice analysis is going to generate figures very similar to what we've already seen earlier in our presentation, where we can show to the penny how much we can save the doctor, how much we can increase their revenue, and what systems we can put in place to grow their business and take all the paperwork and complexity off of them and their staff and outsource it to you, the expert, so they can focus on patient care, which at the end of the day, most doctors don't want anything to do with the paperwork. They want to focus on patient care. Then we partner very closely with you when you're engaged in the sales cycle and the marketing cycle with doctors' offices. Our software experts will actually do live software demos for your interested doctors once you've done the practice analysis. Of course, if you demonstrate to a doctor's office with the practice analysis that you can increase their revenue 20 or 30%, and you're only going to be charging them 6%, this isn't rocket science. That's around a 15% potential improvement in their revenue, and that's net. That's after they pay you. So then all of a sudden they become very interested in seeing what software platform you use. So our software experts will actually do the software demonstration for you, and we close over half of the software demos that your doctors get on. So once we get to this stage in the process, you're really close to getting a client. When the doctor sees our software, they love it, and we've got some killer features. And some of those you can see if you get a software demo from one of your American Business Systems coaches. And then, of course, we're going to help you with the pricing and proposals, and we're going to give you a really compelling formal presentation to go back to the doctor with, so that you can give them to the penny what you're going to be able to increase their office. We have a nice presentation folder that goes along with it. A really great designer must have put that together. I don't know who that might have been. But we're with you every step of the way, all the way through pricing proposals, and then even the billing service agreement. You're running that through our support network and making sure that everything's in line, and you've got the best shot possible to make that one of your new clients for your new business.
Awesome, man. That was a good summary there of all that. Just so you guys, just so we have some clarification, we give you the questions to ask, that practice analysis that Jason mentioned, and then you can actually send the results that they, the answers that they give you. You send that into our support team before you do anything else, and then we're going to actually take a look at what they've told you, and we are going to help you figure out the best. Put your proposal together, basically. We're going to help you figure out the best services to offer that are going to benefit the doctor the most. We're going to help you with your pricing and make sure that you're competitive in the market. So we help you prepare all of that prior to even doing the live demo, so that when the live demo is done by our demo team, you can have that proposal ready to hand off right at the end there and kind of get it wrapped up. So we're very heavily involved in the process of getting doctors to sign up with you. Yeah. Like I mentioned, we've got the five-day live training workshop. We do those roughly every 5 or 6 weeks or so, and I'm gonna show the dates here in a minute. We've got one actually starting next Monday. Next week we have a training class. It's the last one of this year. I can't believe we're already through the year, but it's December 14 through 18. Here's a little brief look at the workshop agenda. This is just kind of a quick summary of all the different topics that you'll learn about in the live class. We do take a session and show you the technical. You do get hands-on training on the system, but the bulk of the live class focuses on the business development and marketing, how all the services work, how much money you can make on each one of them, and the dozen or so different marketing methods that we teach. And then at the end of the training class, we give you a customized, what we call a jump start marketing plan that's tailored specifically to you and your goals. So when you get back home from the class, you're told exactly what to do. Here's what you do the first week, second week, third week, fourth week, and it's repeatable. And so it's very clear. You're not left wondering, well, what do I do today? It's very clear. The training is actually presented by certified instructors that have gone through our program and been certified medical revenue managers. We have licensees that we fly in that have built their businesses to the point where they can just kind of walk away from it, and their staff manages their billing company while they come and help us with the training class. So what better way to be educated than by people that are actually out in the field doing it themselves, right? Like I mentioned, we've got hands-on training. We do take a session in the live class where you guys get to get your hands on the laptop and actually put claims into the system and see how the system works and how to manage that as well. We've got lifetime unlimited support. For the life of your business, you don't have to pay for anything, any ongoing support at all. I don't know of any other company that's offering something like that. Those demos, we do those for free. You just pay us the one-time fee up front for the entire business, which is $24,990, and that gets you lifetime. You're a licensee for life at that point with unlimited support. So that's one of the things that sets us apart as well. We also have a guarantee. I don't know if I mentioned that, but you can kind of, I mean, you can basically use the live training as a final decision maker where, you know, you do have to fill out our agreement and pay the license fee up front, and then once you come through the class, you can sit through the entire class and decide, you know, is this model going to work for me and my family and my goals? Is it going to be something I'm going to enjoy and want to do on a long-term basis? If that's not the case, you can ask for a full refund at the end of the training class, and we will give you 100% of your money back. And we do have that in writing in our agreement. That's how much we believe in our live training. So, like I said, next live training workshops are December 14th through 18th. That's next week. We do have a few seats left for that. If anyone is able to kind of make a last-minute decision, we do have a few seats open still for next week, so give us a call. But if you can't, we do have to wait until February. That's the next class, February 8th through 12 is going to be the next training class. So we would love to have you in one of those classes. Let's go through the questions.
Yeah, we've got a bunch in just a couple of minutes, so I'm going to knock them out as quickly as I can. I'm going to do a couple here right off the top. So we've got our first question from Dev. He had a question way back on the slide where we showed the comparison of what the doctors were paying for in-house billing versus the cost of an American Business Systems licensee, and he asked if that was included in the marketing materials. And yes, that's actually a modification of our practice analysis report, and Deb, that is included in your business package as the practice analysis tool. So you'll be able to generate reports just like that for your clients. Marilyn asked, how much time does it take to file one claim? I love this question, Marilyn, and thanks for that. We've actually timed it with a stopwatch for someone who is used to using the system and has filed some claims, you know, not someone who's just first sat down and they've never seen it. Once you've gotten up and running and you're trained on the system, it takes between 1 to 3 minutes to file a medical claim. So the quick math here is, if a doctor's seeing 20 to 30 patients a day and it takes 1 to 3 minutes to file a claim, you should be spending in the range of an hour to 2 hours a day processing claims for one doctor. And that should generate $25,000 to $35,000 a year in revenue. And then I've got another one here from Valerie. What's involved in importing existing patient info into the iClaim system? Do you have to retype all the demographics? Well, I definitely don't want to get too deep in the weeds here to answer your question, Valerie, but basically it's very simple to do an import from any other system into our system with the patient demographic info. It's a simple export from their prior system, import into our system, and it's highly compatible and easy to do that. However, that's not always the best option. Sometimes it makes more sense to do a clean input for the patient demographics, because a lot of times that's the reason that the doctor's getting poor results. Their demographic information is incorrect. So if you're taking incorrect information and putting it into our, you know, clean new system, then you're going to have problems as well. So sometimes it makes sense to do a clean data entry, and we have a very sophisticated and fast way to do that. And your American Business Systems reps can show you when you have a systems demo done for you. Adam, do you have any of these other questions you'd like to handle? Actually, Valerie, I'll jump in one more. You'd asked about ICD-10. We're one of the few software platforms that has ICD-10 already built in. We have something called a crosswalk that is, you know, expected to be in an ICD-10 compatible system. That's another thing that your ABS rep can demo for you when you do a software demo. And we're one of the few systems that's fully ICD-10 compatible. And that's an important question to ask if you're looking at any other software, or, you know, doctors certainly know that the systems have to be ICD-10 compatible, and ours is. We've been ready for ICD-10 for over 2 years.
Yeah. Deb is asking, apart from the license fee, do we have to pay any other fees? No, you pay that license fee up front, the $24,990. There's nothing else that you pay American Business Systems. Now, based on what you decide, what path you decide to take as far as marketing, then you have some marketing costs, of course. We tell people to plan on spending, you know, it's not much, around 10% of the license fee per year for marketing costs on average. So that's only about $2,500, and that's really, you know, it just kind of depends on what path you want to take. So a lot of the marketing is done, you know, networking. You're going out and, you know, the most mostly what you're spending is your time and gas money to go out and network and build relationships with people. If you wanted to do a big mass mailing, that would probably be pretty expensive, but that's up to you. Most licensees don't do big mass mailings, at least until they have a very large business built up where they can afford it. So yeah, I hope that answers that. Valerie says, if I understand right, we're trusting the codes that the doctor submits are correct. Would we be liable if there was fraud by the doctor? That's a very good question, Valerie. And the answer is your liability is very, very limited the way this business is structured. And we can actually talk about different ways to set up your business entity from a legal standpoint, as far as, like a limited liability company, an LLC, as well as some licensees do opt to get what's called errors and omissions insurance, and I don't want to get too deep on that, but give us a call back and we can kind of explain what that is and how that works. Some licensees get it, some licensees don't, but ultimately the doctors are at fault for any incorrect coding because they're sending the information in and you're just typing it into the system. So hopefully that answers that.
Yeah. Valerie, that's a complicated question, and certainly you could explore that in more detail if that's a concern. But I'll just add to Adam's answer that you're not in the exam room with the doctor, so there would be no way for you to know with 100% accuracy what procedure was performed and what diagnosis was given. So it's not possible for you to knowingly commit fraud unless you willingly go into it with eyes wide open and the doctor says, hey, I want to bill for these procedures I'm not doing. Will you do it? Well, if you agree to do that, then yeah, you would be liable for fraudulently filing claims. But most of our licensees don't do that. And in fact, our licensees have several times we've heard helped doctors who had not necessarily purposely committed fraud, but had been guilty of overbilling, charging more than they should have, and they've helped the doctor take corrective measures and avoided huge penalties. So that's one of the features that you'll be able to help doctors with.
Yeah, that's that audit guard service kind of that we talked about. Yeah. Let's see. Valerie also said, are there any extra services that you offer not included in the startup costs? Well, we actually have additional ancillary services that we don't promote as part of our main, products that you see on the website. And we do that because we know that doctors have other issues that they need help with and they ask about. So we tell our licensees to promote themselves as a one-stop shop for anything outside of practicing medicine. If a doctor asks, hey, can you do this? You should say, yeah. And then you call us and say, what the heck is this doctor talking about? How does this work? We've actually had that happen before with like credentialing and some other stuff that can't get into today. But yeah, so the thing is though is there's no extra cost for those other services that we don't promote on the website. We always grandfather everyone in on new services that come along. We never try to charge you additional money for any new services that come along. So that was a good question.
I feel pretty proud. I think we got through all of the questions except for Dev's, which is the best question to end on. When and where is the next training in 2016 after December? Well, we've got it right there on the screen, Dev. We've got February 8th through the 12th, and we'll look forward to seeing you there. And well, we did.
It's at the Spring Hill. It's at the Spring Hill Suites where we've been doing the training classes. Yeah. So into 2016, we're going to be at the same location, the Spring Hill Suites Hotel, kind of near our offices here in Fort Worth. Yep. All right, everybody. Well, thanks for joining us. We're past 4 o'clock. Everybody have a good day. And if you want a recording of this, just contact us and we can send you a recording of it. And everybody have a good rest of your day.
Thanks for joining us. Take care.
All right. Thanks, Jason.